Hi, my name's Amy Fallman. I'm a physiotherapist, and I've decided to start a little video series answering some questions people have about various injuries and how they can work through them on their own. I've recently decided to name this video series, so this is Physio in Your Pocket. I got a question recently about someone hurt their back deadlifting. A good place to start when you are looking to rehab this is actually my deload reload video, which I posted previously. Generally, when you're dealing with an injury, what you want to do is deload that injury, let it rest and recover, and then gradually reload it. Now, the tricky part with a back injury in specific with deadlifting is actually the deload part. And when you're trying to figure out tools to help you in that deload and trying to find a relieving mechanism, it can actually vary depending on what structure you hurt while you're deadlifting. So the deadlift is this maneuver right here, and it's a really common thing to hurt your back with. Now, what you want to test with this is if you prefer a extension-based movement with your deload or a flexion-based movement with your deload. And what you're really looking for is the relieving factor of them. So particularly with extension, what you're going to do is lay down on your stomach on the floor and let your back relax completely. Stack your chin on top of your hands and then just let your belly sink into the floor. If this is comfortable, you're going to prop yourself up onto your elbows and hold that position. Again, if this is comfortable and relieving and actually takes your back pain away, you're going to want to use this extension-based posture or similar extension-based postures to actually relieve your pain and deload the injured structures. So you can spend 3 minutes here, even up to 5 minutes, a couple times a day. And if you have the time, do it even every couple hours. And this will help you in your deload phase get back to a point where you can start to put some strain back on those injured tissues. Now, the second thing you're going to want to check for is a flexion-based relieving mechanism. So this is where you're going to lay on your back. You're going to bring one knee up towards your chest, and you're going to hold it there. If this is comfortable, check the other side. If that is comfortable, bring both knees up to your chest and just hold this rounded position. This is something, again, you can hold for a couple minutes if it's comfortable. Be careful coming out of it. Come out of it one leg at a time to just take some strain off coming out of a extreme posture. So if this is the comfortable position for you, what you're going to want to do is spend a couple minutes a day in that position. And again, a couple times a day is better. If both of these movements are meant to be relieving, they're meant to feel good while you're doing them and better when you're done them. If that is the case, that's how you're going to work your deload phase. And then when your pain has settled down, you'll gradually start to add some strength exercises in and reload up your back. Great, I hope you find this useful, and good luck rehabbing your back injury.